Hi, I'm Annette Robinson, nurse practitioner at South Georgia Medical Center, providing primary care at an internal medicine office. The public image of a nurse being professional is how she dresses. There are attributes of nurses such as caring, attentiveness, efficient, knowledgeable, competent, and approachable, or like thereof, can contribute positively or negatively to the patient experiences. Nurses, how a nurse appears can have a significant effect on how patients perceive the nurse. The goal of the healthcare team is to provide the best possible outcomes and experiences for patients and family. Registered nurses have a professional goal in all aspects of care and interaction. First impressions are often formed in an instant, so how a nurse appears can have a significant impact on how patients perceive the nurse. A uniform serves as a reflection of how the public identifies roles of the wearer. Although consistently identified as a member of the most trusted profession, contemporary nursing still struggle with an image. In reality, the uniform influences the perception about nursing practice and thus contributes significantly to the overall image of a nurse. Nursing uniform that most RNs wear today have changed significantly. Prior to generations of healthcare professional personnel, particularly nursing staff, was required to follow stringent dress codes and work attire policies. White uniforms and nursing caps have been replaced by colored scrubs that has cartoon or holiday print decorations, while polished nursing shoes have been replaced by multicolored sneakers and clogs. Forces external to healthcare, such as the media and online marketing, have promoted individual preferences as a new experience of teaming and unity, resulting in more uniform attire. Nurses had concern about the impact of various uniforms and dress choices noted in their facility. Feedback from patients doing rounds, interaction with family members and colleagues at other healthcare institutions indicated and uncertainty about who nurses were and the care that they were providing. In 2014, nurse leaders identified the need to consistently enforce the dress code and a perceived decline in the professional appearance of the nursing staff. Feedback from patient rounds, interaction with family members, and colleagues at other health organizations indicated uncertainty about who nursing care providers were and how to identify different levels of nursing personnel. Nurse leaders began to discuss the need for an evidence based project to determine patient perception of professional images of nurses in inpatient and outpatient settings. At the same time, staff members had begun an online dialogue to our system internet, expressing concerns regarding the informal nature of the nursing staff attire, such as nurses wearing hoodies, leggings, fleece jacket, and t-shirts while working. Concurrently, nursing staff on one of the adult units, the medical surgical, being specific, for its concern about variations in fellow staff members' pattern of dress and appearance to unit leadership. Staff of all skills levels, many of whom had worked in health care settings for many years, began a dialogue about professional appearance as it related to peers who were working and wearing clothing that did not meet traditional uniform standard. Some patient statements indicated that staff members appeared ready for gym or dressed like they were going to the club, not as professionals in a hospital. But during this time, there were also discussions regarding patient perceptions of professional appearance related to not only attire but other expressions of individuality, such as jewelry, piercing, and tattoos. Some patient statements indicated that the staff members appeared ready for the gym or dressed like they were at the club, not as professionals in a hospital. So, unit staff leaders noted that patients and families often expressed that they could not differentiate the skills of staff members. Other staff contended that many patients and families who were in distress or crisis liked the distraction of conversation about staff tattoos. They then shared stories of their own body art, allowing for development of rapport in the patient caregiver relationship. But based on the staff, many conversations about patient stories and opinions in terms of their own work life, professional appearance, and patient experience, unit leaders identified a need to address the concerns by considering revision to the dress code policy. The current policy described acceptable types of clothing and stipulations about tattoos, but was not based on actual patient perception of what elements of professional image translated to the patient. The aim of one of the projects was to assess what the patient perceived to be the most professional appearance, communication, and action by a nurse. Nurses has a long and varied, valued history of using research to impact practice, beginning with the earliest pioneer, Florence Nightingale. Evidence-based practice is the conscientious and judicious use of current best evidence in conjunction with clinical nursing knowledge and patient values to guide healthcare decisions. So the process began with a question followed by an extensive review of literature to evaluate what answers and discussions already exist. So the project was to assess the patient's perception of the professional appearance and communication by a nurse. So the goal was to use the finding to create an evidence-based dress code that would support the most professional image of nurses in our facility and hopefully contribute toward the best patient experience. It has been a pleasure to present to you all this information about the dress code